Well, good morning, everyone, and I want to thank you so much for having me. It's really great to be here with you, even if it's only virtually. And before I get started and diving into the talk today, I did want to say a word about your governor, Rob Allison. Rob is truly considered one of the leaders of the Board of Governors, and he's always looked to as a source of thoughtful insight in all of our deliberations. And he and the South Dakota chapter, actually, as a whole, are really an inspiration for the advocacy work that you do here, both at your state level and also on the national level. So you should know that your governor is doing a really great job. And so it's even more of an honor that he invited me to be here today. And of course, I was so excited to come out to South Dakota when it was originally planned for an in-person event last fall that I arranged a 3-day backpacking trip in the Black Hills as soon as the conference was over. Of course, even though the conference is now virtual and there's a pandemic, I was still able to head out with my brother and two of my nephews. And we had an absolutely spectacular time. Here, of course, many of you recognize the Black Elk Wilderness area, and there's our intrepid group doing a little bit of backpacking and camping and enjoying South Dakota hospitality. So, thank you all so much for preserving these treasures in your state. I do want to say a little bit about me. I'm an outpatient physician. I have a small independent primary care office with two colleagues, and this is us kind of at the beginning of the pandemic. We are located in Charlottesville, Virginia. Charlottesville is located at the foot of the Blue Ridge Mountains. We are known for being the home of Thomas Jefferson and the home of Monticello. Many of you may recognize that. For those of you who still carry actual change in your pocket, it's the house on the back of the nickel. And many of you may follow our men's basketball team. They won the national championships in 2019. A lot of other people have come to know Charlottesville recently for being the site of a series of white supremacy rallies in the summer of 2017 related to the statue of Robert E. Lee and whether it was going to be taken down. That those protests turned deadly, actually, and a young woman from our community was killed in that. But 4 years after those rallies and scores of legal battles later, the statue of Robert E. Lee has now been removed. Anyway, on to the discussion of what the American College of Physicians has been up to over the past year. And I wanted to start by saying what I think of the American College of Physicians. So when I think of ACP, I think of an organization that helps its members achieve the highest levels of professionalism, an organization that provides the resources which allow physicians to remain up to date on the latest advances in medical knowledge, that advocates on behalf of physicians to better the practice of medicine, that advocates on behalf of our patients to improve access, advance equity in care, and enhance the patient experience, and one that champions causes at the national and international level that hopefully will make all of us safer and healthier. And I don't think there has been a time when ACP's mission has come into sharper focus than during this pandemic. And I don't think there has been a time when the organization has worked harder on behalf of its members, quite frankly. So ACP, as you know, has a huge book of regular business that keeps the organization busy on any regular day. But during the pandemic, we had to surge, as it were, in our support of our members. We stood up a comprehensive COVID-19 resource hub. The URL is listed here. We put together a lot of clinical and practical tools and information that was regularly updated. We had to develop new policies and recommendations to address the novel situations and circumstances we found ourselves in. We vigorously advocated and stepped up our advocacy for ACP members and for patients. and we published a lot of very important material and research related to the pandemic in Annals. One of the first things our education division did was to start up this resource called COVID-19 and ACP Physician's Guide. It's an online mobile-friendly clinical overview of infection control and patient management guidance. Initially, at the start of the pandemic, it was updated perhaps multiple times per day, and then as things calmed down, daily or several times per week. And at one point, it was one of Google's top search results for COVID-19 information for physicians. Now we are over a year into the pandemic and we've sunset the updates of the clinical guidelines. You can still access the information, but the last update was June 11th, and we are now referring our members to such sites as the CDC and the NIH. We also quickly realized that our members needed support to quickly visit to telemedicine. I personally went from never doing a telemedicine visit to that was about 90% of all I did, especially in the first few weeks of the lockdown. We developed an online interactive CME program, so you can get CME credit for it to help physicians implement telemedicine, including information about patient care during pandemics and public health crises. We put together resources for telehealth coding and billing during COVID-19 and had information on coverage rules and technology options and so forth. And we partnered with Annals of Internal Medicine to put together a whole suite of vaccine forums. And these forums included people such as Tony Fauci and Rachel Levine of HHS and David Kessler of the FDA and Beth Bell of the Advisory Committee on Immunization Practices, Paul Sachs and Carlos Del Rio, and many others. And you can still access these forums from our website. They are still up there, and you can get CME credit for these. ACP put together several other key educational resources. One of the most innovative things the college did was create these living practice points that created guidance, which was updated as new information became available. And we put together living practice points on hydroxychloroquine and chloroquine. What is the antibody response and role in conferring natural immunity? We put one together on remdesivir. We put one together on N95 respirators, surgical masks, and cloth masks. And ACP has partnered with YouTube to combat misinformation about COVID-19. So some of these are out there already and more are being developed. And we were concerned when the pandemic started that our members did not have appropriate access to personal protective equipment. So we partnered with an organization called Project N95, the URL is right here, to sell personal protective equipment to our members. And we had two big sales. This was back in 2020 still, in June and August. And we had about 2,500 of our members order. And the average order size was relatively small, which to us means that the target audience that we were trying to go after, which is small independent practices, did take good advantage of this. And now the good news is that you don't have to wait for group buying opportunities. You can purchase, if you need PPE, directly from Project N95 at any time that you like. We did have to develop a lot of new advocacy and policies in response to COVID-19. We did support vaccine mandates, and we have signed on to several amicus briefs for cases that are now before the Supreme Court. Obviously, those decisions are pending on vaccine mandates. And we came out in strong support of wearing masks to reduce the transmission of COVID-19. We really stepped up our advocacy for our members in a couple of very important ways. We advocated that not only should telehealth be reimbursed, but that it should be paid at parity to in-person visits. We advocated that telephone visits should be paid, but not only paid, but that they should be paid at parity to to in-person visits. We advocated for money to support physicians through the various stimulus packages, such as the CARES Act and the Paycheck Protection Program. And we have pressed to continue telephone and telemedicine visits beyond this pandemic. And during the midst of the pandemic, we have urged Congress to increase visa processing for international medical graduates. And of course, this pandemic has brought to light what we've known all along. Internists are essential. And this slide is kind of my reminder to thank you for all the work that you are doing every single day on the front lines of this crisis. I think I can speak on behalf of ACP leadership that we could not be more proud. You not only exemplify the best in medicine, I think that you exemplify the best in humanity. And we do have this wall of honor lost on the front line, honoring our internists. If you do know a physician or member of the ACP who has lost their lives in the battle of COVID-19, please consider making sure they go on this website, on the ACP site. So that's is what the college has been doing and really continues to do during this pandemic. But I did want to turn our attention to the ongoing work of the college, starting with our advocacy work. So much of our advocacy is really predicated on a series of recent policy papers published in January 2020 as a supplement in Annals of Internal Medicine. This consisted as a call to action. Better is possible, the American College of Physicians' vision for the U.S. healthcare system, along with 3 companion papers on coverage and cost of care, reducing barriers to care and addressing social determinants, and healthcare delivery and payment system reform. So through these vision statements, ACP envisions a healthcare system where everyone has coverage for and access to the care they need at a cost they and the country can afford. That social factors that contribute to poor and inequitable health, so-called social determinants, are ameliorated, and barriers to care for vulnerable and underserved populations are overcome, and no person is discriminated against based on characteristics of personal identity. Where payment and delivery systems put the interests of patients first by supporting physicians and their care teams, where spending is redirected from unnecessary administrative costs to funding healthcare coverage and research, public health, and where clinicians and hospitals deliver high value and evidence-based care within available resources. And we really found that there are 2 ways we can achieve this type of system. Universal coverage can be achieved through either a single payer system or a public option along with regulated private insurance. Now, they both have pros and cons. A single payer financing approach could lead to increased portability, lower administrative costs and complexity, but is more disruptive and does eliminate choice of private insurance. A public choice option, along with regulated private insurance, would be less disruptive, certainly. It would allow for more choice, but it would likely not ease administrative burden as much, and it would probably not lower administrative costs as much. Additionally, ACP released a number of other policy statements over the past year. We put together a policy on veterans' health, on financial profit in medicine, on health information privacy and protection as our digital health ecosystem expands, policies on prescription drug competition, and racism in health. So that's what's going on in the policy realm, and I wanted to talk a little bit about ACP's educational initiatives. Now, in a normal year, Annals of Internal Medicine processes about 3,000 submissions, but during 2020, That number was closer to 8,000, and I would say the same goes for 2021. And Annals has published some extremely important research and has therefore become the most cited internal medicine journal worldwide. Now, you may notice that Annals has now uh, become one edition or one print edition every month, but still the same number of articles is published every month. You just get it as one edition per month instead of two print editions. And this is something new and exciting that I think will be of special interest to program directors, fellows, residents, and medical students. ACP has partnered with the American Heart Association to publish Annals of Internal Medicine Clinical Cases. This is a digital open access, peer-reviewed journal, which is starting up as we speak and is accepting submissions at this time. And of course, MixApp 19 has now been released. MixApp is the most trusted board prep program and probably one of the most trusted programs for lifelong learning of medicine. I think some of the new things that you will find in MixApp 19, earn as you go CME. In the previous editions, you had to complete a whole section before submitting for CME and maintenance of certification. Now you can do it as you go along with every question that you answer. It's the only board prep program with questions that are mapped specifically to the ABIM blueprint. There is enhanced multimedia and customized learning plans. And ACP continues to be a leader in developing evidence-based resources that help our members and the entire internal medicine community deliver the best possible care for patients. Clinical recommendations are developed by ACP's Clinical Guidelines Committee. Over the past year, we published recommendations on the following areas: point of care ultrasound, high flow nasal oxygen, short course antibiotics in common infections, World Health Organization guidelines on Hep C infection, and treatment of non-low back pain from musculoskeletal injuries in adults, and testosterone treatment in men with age-related low testosterone. And I do want to remind you of our online Learning Center Hub. This is a centralized gateway to more than 350 online CME and maintenance of certification learning activities. Many of these, or most of these, are free to members. And we put together some new learning hubs on both pain management and obesity management, and you can get CME and maintenance of certification points for both of these. And I also want to remind you about Dynamed. This is a free benefit of ACP membership. Dynamed is a point of care clinical decision making support tool. I use it almost every day on either my office computer or on my smartphone. It is somewhat like Up to Date, but unlike Up to Date, it really mostly relies on evidence based medicine and de emphasizes expert opinion. And of course, there are a lot of podcasts to make use of. For those of you who like to listen to podcasts, the DEI shift or day shift discusses topics surrounding diversity, equity, and inclusion. Uh, Bedside Rounds is a podcast centered on historic stories of clinical medicine and how they relate to today. And of course, Core IM is just like it sounds. It takes a deep dive onto core important internal medicine topics. And then Annals on Call, hosted by the incomparable Robert Center from Alabama. He and guests debate and discuss recent articles from Annals of Internal Medicine. And of course, I want to make a big plug for our internal medicine meeting, Mastering Medicine Together in Chicago at the end of April. This will be a hybrid meeting. You will be able to attend in person, or if you can't attend in person, you can attend virtually. It is going to be great. I urge you to take advantage. It's a great opportunity, hopefully, as we find that COVID cases fall at that time of year. Let's hope. I do want to talk about some of the resources ACP has put together to help you in your practice. This is something I'm excited about because I was a big part of helping to put this together, an independent practice resource hub that you can access from the homepage of acponline.org. It includes a range of resources to help practices with the business side of medicine, including all types of resources on payment and coding, on regulatory rules, and enhanced patient care. And of course, we continue to be very, very concerned about the very real issue of physician burnout today. We have been working on that. We have this emotional support hub, which is a collection of resources helping members improve their emotional well-being. There are resources for free counseling through the Therapy Aid Coalition and the Emotional PPE Project. There is a physician support line, various webinars and tips for managing stress. And we have just put together a whole series of new well-being videos for internists coping with stress, offering practical strategies to cope with the daily burdens, and remembering to practice self-care. These are short videos with information that you can use. I don't think any discussion would be complete about talking about maintenance of certification. This is a part of almost every leadership meeting that we have. And of course, ACP leadership meets with ABIM every single month. We have been urging them and pushing them to move beyond this high stakes, secure summative examination and move towards a formative approach that utilizes resources of adult learning. So we are really pleased that ABIM is going to roll out its longitudinal assessment program in 2022, and we will continue to engage with the ABIM to make sure that this fits the needs of our members. We really pushed ABIM hard um, to not penalize physicians during the pandemic for failing to meet maintenance of certification guidelines. So we were very pleased that ABIM has extended the deadline for all maintenance of certification requirements to the end of 2022, which means that no one will lose certification if they aren't able to comply with their maintenance of certification requirements this year. And therefore, in 2022, and the following year, you can glide directly into um, the longitudinal assessment program. And I got this information off of the ABIM website just to kind of highlight what they're planning to do. They're planning to basically push out 120 questions per year that physicians need to answer. You can skip 100 questions over the span of 5 years. Once you sit down and decide to answer the questions, you have about 4 minutes per questions. You can answer any place or time. You can access any resource that you generally use in practice, and you can earn maintenance of certification points for doing this activity. So a little bit about ACP kind of as a whole. Our mission at ACP to enhance the quality and effectiveness of healthcare by fostering excellence and professionalism in the practice of medicine. We are 161,000 members strong. We are the largest medical specialty organization in the United States. We do have members in more than 145 countries worldwide. There are 17 international ACP chapters, and more than 19,000 of our members actually reside outside the United States. I think it's worth discussing our 4 priority themes, which permeate through all the activities of the college. We have membership growth and engagement, our goal to engage more members in college activities and increase the value of membership. Innovation and strategic alignment, align activities and resources to leverage and enhance ACP's potential to deliver new and valuable services to our members. Valued professional identity, increase enthusiasm and pride about being an internist and about the value of internal medicine specialists. And diversity, equity, and inclusion to achieve a just, equitable, and inclusive culture at ACP. ACP has made an organizational commitment to being an anti-racist organization. Our goal is to welcome and respect the many diverse voices of internal medicine and its subspecialties. And some of the ways we are going about doing that, we have established a diversity, equity, and inclusion committee that reports directly to the Board of Regents. We have updated our diversity, equity, and inclusion policy. We are co-sponsoring a grant program called Building Trust Through Diversity, Healthcare Equity and Inclusion in Internal Medicine Training. We've established anti-harassment policies and reporting processes. And of course, we are listening. We are listening to current members, current leaders, and past leaders to assess our DEI needs. And we are trying to support ACP chapters in establishing their local DEI committees and local women in medicine committees. A lot of people ask me, how can I get involved or further involved in ACP? I think chapter involvement is an opportunity for internists to give back to their community and to take part in educational opportunities and help influence state legislation and, of course, network and, of course, learn from the experience. I think how you get involved really depends on how much time you have. Uh, we call micro volunteers those who may have several hours to devote. You can recognize your peers. You can nominate colleagues for national and local awards, help advance members to fellowship. You can help review resolutions. You can help write a chapter resolution. If you have a little more time to devote 8 to 20 hours over the span of a year, you can consider being on your meeting program committee, serve on another committee or task force, participate in your advocacy events. You can consider being an abstract or poster judge or reviewer, a speaker at a state meeting, host a networking event or a well-being event. And then, of course, if you have a little bit more time, 2 to 4 hours per month over a couple of years, you could consider serving on the Governor's Advisory Council. You can consider chairing a committee or serving as an officer or being a well-being champion. Here's something, if you're not involved with, is a great way to begin your participation, is to join Advocates for Internal Medicine Network. This is a grassroots advocacy network designed to help ACP members engage with federal lawmakers on policy issues important to internists. You would receive legislative updates. We're not going to spam you and overload your inbox, but when there are important issues unfolding in Congress or when votes are coming up that are relevant to our profession, we would send you a message, and there would be a link for ways that you then can directly contact your members of Congress and let your voices be heard. And remember all the ways you can stay connected with ACP. And again, I want to thank you for your continued support and all the work you are doing every day. I'm looking forward to a wonderful rest of the conference, and I look forward to any questions you may have. Thank you.